The MD News Network recently visited Nashville, Tennessee to attend the Healthcare Information and Management Systems Society's Summit of the Southeast. At the HIMSS conference, we had the rare opportunity to speak with physicians, politicians, hospital CEOs, CMIOs, and CIOs, as well as HIMSS executives and healthcare information system vendors. We spoke with them about a number of things, including the present and future of electronic medical records, how physicians are shaping the future of healthcare, hospital progress in EHR implementation and computer physician order entry, and much more. Here's what our cameras captured.
I was disappointed that reform really only added 32 million people, which is great. I'm all for people having health insurance, but it added it to a system which really has got some flaws and some creakiness that's starting to become very evident now without really changing the underlying system. So I hope in the years ahead this is going to continue to be contentious. It was passed, with no Republican vote. Things like Social Security and Medicare were both contentious at the time, but they passed with the Democrats and half of the Republicans in each of those cases. So when the vote was over, it was over and we got on with it. I think, unfortunately, health reform, because it became so polarized, is going to be an issue and a litmus test issue for candidates for a long time to come, and it's not a good thing. I think we're going to have to continue to evolve it. I think that what happened in this administration is just the opening round of some changes, and I would like to see us move in the direction of just putting more power in the consumer's hands. I mean, I really believe health insurance, or the payment for health care ought to be divorced from an employment situation. It ought to be like Social Security. It's something that I own or you own. You take it from job to job. If you're unemployed, it continues, and not something you got to get from your employer or go petition the Department of Health and Human Services for your health insurance. And if we make some changes like that, I think we'll end up with a fairer system and one in which we'll have a little better allocation of resources.
There's a vast disconnect in our country between, if you have insurance and you have money, we have the best health care in the world, there's no doubt about it. If you don't, or you're poor or marginalized or one of the working poor, then you don't get the same health care as everybody else in this country. Plus, we're clogging up our ERs, which is a vast waste of resources. We really need to shift our focus, and EMRs and technology can help us with that, because it can help streamline where patients are going, where they're coming, and making sure we're using our resources in a wise fashion. If somebody's had an EMR or an MRI 2-3 weeks ago at a different organization, you need to know that, because you don't want to repeat that, because that's a waste of our resources.
There's a large number of variables being introduced to an already complex equation. So the downstream effects, and if you could argue that there are obvious critical needs, like there's a lot of segment of our population not covered by health insurance at all. So that's certainly advantageous. The challenge is going to be paying for it. So we're hoping we're going to focus on where 80% of healthcare costs go, and that is hospital admissions, mostly for end-of-life type situations. Here's an opportunity for us to use technology to provide, better health for some of our most vulnerable citizens, people, elderly folks in particular with chronic diseases, better quality of life, extend their life, and at the same time greatly reduce healthcare costs by preventing unnecessary admissions to hospitals. So I think if we focus on that, we can add value, we can reduce the overall cost of healthcare, and also provide incentives for clinicians, fund them actually to provide better care the patients in our medical home, and similar models. That's not everyone's totally comfortable with that model, but something like that we think would be beneficial.
Now that you've heard the HIMSS conference attendees' opinions, we want to know what you think. Click on Share Your Perspective at mdnews.com to let us know.